You're listening to a podcast from the South China Morning Post.
Is there a second wave of the coronavirus?
The list of authorities around the world reimposing coronavirus-linked lockdowns is growing.
Fears of a second wave of coronavirus cases appear to have materialized.
Nationwide, 14 states have reported a 25% increase in COVID cases.
Scientists have warned that in a worst-case scenario, a second wave of coronavirus cases in the UK could result in around 120,000 more deaths.
As the country endures a major surge of coronavirus cases.
The question now is not if this is a surge, a spike, a second or third wave. The question now is how are we in cities, nations all over the world going to hang on and figure out how to live in a very different kind of world until a vaccine is found for COVID-19. Because here we are in the middle of July, just like the flu pandemic of 1919, the world is seeing a new surge. The last time we were recording an episode of this podcast, we mentioned the psychological effect of 12 million cases of coronavirus. It's 1 week later. By the time you hear me say these words, it's likely that the number will be 14 million. And that's 2 million more people infected since last week. We're going to have to work together if we want any hope of stopping the spread of the virus. Welcome to another episode of Inside China. My name is Mimi Lau.
And my name is Kinling Lo. This week, once again we find ourselves working from home while the newsroom of the South China Morning Post in Hong Kong has only a skeleton staff. And here we are back in our makeshift recording studio in a lounge room on Hong Kong Island. Hong Kong is seeing a new wave of cases being reported. Masks are now mandatory on public transport and in taxis. The bars have been shut again. Restaurants and cafes can only serve takeaway food after 6 p.m. And once again, our reminder to you, the listener, please keep up to date with the latest developments in the pandemic via our 24-hour coverage at scmp.com. This week, we saw reports of Miami in the state Florida being announced as the new Wuhan, the global epicenter of coronavirus, while around the world, we watched different cities struggle with a second lockdown as the new waves of coronavirus strike. In this week's podcast, we're going to talk with Professor Ben Cowling at the University of Hong Kong School of Public Medicine. Every time he's been on this podcast since February, he's correctly predicted what was going to happen. We are going to ask him about the changing advice over wearing masks and the controversy concerning the World Health Organization and whether coronavirus is an airborne virus.
I think now there's still this question about how it's spreading, which hasn't been resolved. But from the World Health Organization point of view, there'll be a reluctance to change the position completely because most parts of the world don't have the capacity to deal with airborne precautions for their staff.
And with the world trying to figure out a second lockdown of its major cities, we're going to bring you a behavioral economist to help explain the psychology of why people are resisting these new lockdowns.
In the case of, mask wearing and the second lockdown, it's going to depend on what people sort of have in their mind as that benchmark. If they think that things like eating out in restaurants and, all the things that we used to do in normal life are our benchmark, and they're comparing, what we have to deal with during the lockdown to that, then they're going to feel a sense of loss and they're going to be reluctant.
And after months of talking about the infodemic of bad information, false rumors, and conspiracy theories, we have some good news about how Facebook is being used.
I feel like there are quite a few people that like to just write down their thoughts like it's a journal and let it out there. So we definitely have all different layers of the mental health aspect for sure.
We're going to introduce you to a woman who is a moderator on a Facebook group, helping people all over the world deal with how COVID-19 has changed their lives.
It is kind of a safe space from conspiracy theories because the people there generally are sick.
So let's get started. Let's take you to the office of Professor Ben Cowling.
Now, Mimi and I were busy on other stories this week, so we sent out producer Jared Watt to visit Professor Cowling. So it's his voice you'll hear, asking the professor questions.
Hey, thanks, Mimi. Thanks, Kinling. Listen, before we get into this interview, let me just recap a bit of information for people listening to this podcast for the first time, or indeed wondering, who is this Ben Cowling guy? Now, he gave us a great introduction to himself back on our February 14 Inside China podcast, the one that's titled Forecasting Coronavirus Spread, Dr. Li Wenliang and China's Crisis. But here's a quick update for you. Ben Cowling is an epidemiologist who started at Hong Kong University just after SARS back in 2004. In 2013, he became head of the Division of Epidemiology and Biostatistics, and he's also a co-director of the WHO Collaborating Centre for Infectious Disease Epidemiology and Control here in Hong Kong, which pretty much led the world's response to coronavirus as the information emerged from Wuhan back in January. He's been pretty busy since then. And if my voice sounds a bit muffled in this, it's because I'm wearing a mask.
Dr. Ben Cowling, here we are in your office at the HKU School of Public Medicine. How are you holding up?
Yeah, I'm okay. Really busy for the last 6 months now, kind of non-stop. Everyone needs a break, but we can't have a break because now we've got the second wave to deal with. So it's kind of never ending for us, but we're doing what we can. And we feel like we're in the right place at the right time to be of some use to the public.
Now, depending where you are in the world, they're either seeing a surge, a second wave, a third wave. What's your research telling you about what we're seeing around the world right now, and of course in Hong Kong?
If we go back to the beginning, to January, February, March, when we started to see infection spreading around the world, numbers of cases going up and up and up, and then a lot of measures were put in place to deal with that and to stop the spread and to bring case numbers down. And those were very successful all around the world. But as time goes on, those measures can't be kept in place forever. We can't stay under lockdowns for a year. In Hong Kong, we can't work at home for a year. The children can't be off school for a year. So the measures have been lifted over the past maybe 2 months. And now what we're seeing is a resurgence in infections because the measures that were holding infections back have been relaxed. So that's then the potential for infections to spread once again. For Hong Kong, we had quite a period of time without local infections, but now somehow, somewhere, infections have got back into the city, and we're seeing the result of epidemic spread just like we saw back in March, where without sufficient public health measures, there is a rise in infections from day to day, from week to week, and that will continue until we see the effect of stricter public health measures, which have just very recently been put in place, speaking today on the 15th of July. So I would guess it's about 7 to 10, maybe 14 days after measures are implemented that we begin to see their effect, meaning that towards the end of July, we should see daily case numbers begin to come back down again, assuming that all these measures are being effective, which we think they should be. And then it may be sometime into August that we get down to zero again, perhaps not until the end of August that we get back down to 0 cases. And that would be just in time for schools to restart. But of course, then, let's say we open up again back to normal in September, schools open, people working. Within maybe 2 months, we'd have a third wave in Hong Kong and we'd be back to the same issues. Are we going to go working at home again, close schools again, social distancing again, maximum group size 4 again, all these measures. So it's really frustrating, but at the same time, at least we've had a rest for the past few months, maybe 2 or 3 months. And now we've got to go back into tighter public health measures again, maybe for a month or 2, and then we can relax again, and then we have the measures again. We really do not want to have a large epidemic of COVID-19 in Hong Kong because the health impact would be devastating. We know what the severity profile of infections is like. We've got all the evidence we need from around the world that if we allow thousands, tens of thousands, hundreds of thousands of people in Hong Kong to get infected, there'll be a lot of serious infections, a lot of people going to hospital, a lot of people needing to go to intensive care, and even, unfortunately, a number of deaths. And we can do those calculations, those predictions, to know what the health impact would be. And we know for sure that we do not want that to happen. So it's well worth having all of these public health measures, even though they're very disruptive, even though they're economically costly, because the alternative of allowing COVID to spread would be much worse.
When we first spoke to you, you explained to us the R0 factor and how there was, back then, each person who gets coronavirus, COVID-19, liable to infect 2 people. Now it's 4. What's changed?
It's a good question. I'm not sure that it really is 4, but certainly we've been tracking it and we think it's at least well above 2 at the moment in mid-July. And it's not clear whether the virus has changed and maybe become more transmissible. When we compare back to what was happening in March, and the reproductive number was also hitting about 2, at that point in time, we still had schools closed, we still had cancellation of mass gatherings, so we were not observing like the real reproductive number, without having any interventions, because we did have some interventions in place. Right now in July, we've actually pretty much opened up. There's not that many measures in place. Just very recently, there's been quite a number of restrictions implemented to tighten up. And I guess that's going to bring the reproductive number down again below 1. So we've had a period of maybe a couple of weeks where the reproductive number's been definitely above 2, maybe 3 something. We're going to see that coming down now. But because there's been an opportunity to spread, so we've been having 30, 40 cases a day recently, that's going to continue for at least another week, may even hit 50 a day a few times, maybe even more. Let's see. Hopefully we don't have any really large outbreaks to deal with. But then within maybe 2 weeks, we'll start to see those numbers begin to come down. But they're not necessarily going to go down to 0 straight away. We go from 50 a day back to 40 a day to 20 a day, 10 a day, and then a few mopping up the residuals. And it may take a little while. And we also need to remember that even when there's no local cases for a period of time, we may still expect outbreaks to pop up, like the Licuna State outbreak. If you remember back in February, what some people call the first wave, but it wasn't really an epidemic wave, it was just some outbreaks. There was the cluster in the North Point Temple, there was a hot pot cluster, a few other sporadic infections. That could be happening again when we come to the end of August and September and October. We have these kind of smaller outbreaks that don't necessarily go anywhere, but it just takes one of them to get into an elderly home or into a restaurant, and all of a sudden then you see what's just happened in the past week or so, where there's a lot of infections fairly quickly. And that's something that the public health measures are intended to prevent. So we don't like to have mass gatherings, because if there's one case in a large group of people, that's a potential for a large number of infections in a short space of time. And that's really difficult to deal with.
Talking about public health measures, it's been fascinating to see the global culture change in terms of wearing masks. Now, everyone in Hong Kong knows about the history, the culture of masks. Thanks to SARS, there was never an issue. After all this time, we've seen US President Trump wearing a mask, which was a huge statement in itself, but mask wearing becoming mandatory in various cities around the world, and now in Hong Kong in public transport and in taxis. What are your opinions on that idea of mandatory mask wearing?
In Hong Kong, we've always recognised that masks can help. Even from the early days, we've been tracking people's behaviours. And from early February, we had almost universal masking in Hong Kong. We had almost 100% of people wearing masks all the time in public. And I think the places it really, really helps is in public transport and in crowded areas, because it limits the opportunities for spread. But having said that, we've always understood that masks are not sufficient. They're not the only measure that's needed. They help, but we also need other things. And that's demonstrated by the most recent outbreak in Hong Kong, the second wave, where in July we've had 30, 40, 50 cases a day, despite everybody in Hong Kong wearing masks all the time. We understand that there's been a little bit of slippage, that maybe it's not 100%, it's gone down to 90%, but that's still remarkable compliance, remarkably high use of face masks. And if all we need to do is wear face masks, then we shouldn't be having a second wave. So we recognize that masks are important. They do provide protection for everybody, but we need other measures as well, like social distancing. I've been surprised because in other countries, they didn't recognize the value of masks in the early days. I remember in the US, in the UK and other European countries, a lot of discussion about how masks would not be helpful, They were not necessary. You could even have an increased risk of infection if you wore a mask, which is nonsense. And there was this very strange public health messaging about masks not being required, which has now turned 180 degrees. And the same people are now saying that masks are really important and going as far as making them mandatory on public transport and in shops. I think in the UK, in the US, in some cities, it's now mandatory to wear masks outdoors. It's a remarkable shift. I hope that they're not placing too much reliance on masks. I've heard some worrying anecdotes that some political leaders are imagining life can get back to normal as long as people wear masks. We've seen in Hong Kong that that's not true. Masks definitely help, they play a role, but we need other public health measures in addition to face masks in order to stay on top of transmission. Whether or not it's a good idea to make masks mandatory is a difficult question. Not everybody in society can afford a plentiful supply of face masks. Some masks are better than others. And I worry a little bit that if we make them mandatory, there's some, I don't know if it's discrimination, but some issues for the lower income segment in society. And there's also then pressure on supplies of masks because there's even more and more demand and people wear masks where they don't necessarily need them. I live near the country park, near one of the country parks in Hong Kong, and I see people wearing masks in the middle of the countryside when there's nobody else around, and it's not necessary. You're not going to catch COVID-19 in the top of a hill somewhere. So I think we've got to be clear about where's the important places to wear masks: on public transport, in crowded areas, in places where there's lots of people, particularly indoors. And I'm really glad that in other countries they've recognised the value of masks and are now encouraging them and recommending them.
Well, speaking about public health messaging from the very top, from the World Health Organization, this debate, this discussion over the evidence of airborne or floating viral particles, when seems to have started some sort of controversy. Are you part of those discussions, and what can you tell us about that?
Yeah, I'm a member of the World Health Organization Advisory Committee on the way that COVID-19 spreads and the ways to control it. So I've been party to some of those discussions, but I'm aware of the bigger issues as well. So if we step back a moment and think about influenza, the flu, we still don't completely understand how that spreads from one person to another after 100 years of research. For COVID-19, we've only been following it for 6 months. So there's much less information available than there is on, for example, for flu. And we still don't completely understand how flu spreads. What we do recognize is that when someone with COVID-19 or someone with flu or another infection, when they're infected, the virus is in their respiratory tract. That means the nose, the throat, the thorax, the lungs, and the virus has to find a way out of the body to infect other people. And when the virus is coming from the lungs, most likely it's coming out of the infected person's mouth in droplets of a range of sizes. Larger droplets like the ones that you see when someone sneezes, and also smaller particles that you can't see, and those can stay in the air for longer. For flu and for other common infections, we've determined those viruses can be found in particles of all different sizes and can potentially cause infections. For COVID-19, we also believe that virus can be found in particles of all different sizes, which means there's the potential there for transmission to occur through the smaller particles, which in theory can stay in the air for longer and can travel further distances. So a good analogy is with a smoker in a restaurant. If you're in a restaurant and there's someone smoking, actually it's not allowed in Hong Kong anymore, but in the days when it was, if there's a person smoking in the restaurant, if they're sitting at the next table, depending on the way the air's blowing, you may well be able to smell the cigarette smoke. It may bother you. If they're sitting on the other side of the restaurant, or if they're sitting even next to you, but the air's going the other way, there's a fan blowing it away, you don't smell it. So for virus to spread through the air really depends on how the airflow is working and how close you are to the source. And one of the most important things to recognize is even if COVID-19 is spreading in that way, the risk would really only be present at close range, because if you're at the other side of a restaurant from a case, there's so much dilution going on that unless they're pumping out enormous amounts of virus into the air, there's almost no chance that any of it would reach you. And we know that patients with COVID-19 are not very contagious in general. Where the World Health Organization has got a little bit tied up is in the distinction between two different questions. The scientific question of how's the virus spreading from one person to another, and the practical question for hospitals particularly about what infection control measures are prudent or justified in order to protect healthcare workers and staff and patients from COVID-19. And to answer the second question, the experts in infection control have different sets of procedures depending on how serious a threat an infection is and how they think it's spreading. And what the WHO decided in the early days was that it probably wouldn't be feasible to recommend the highest level of precautions for COVID-19 because either most parts of the world don't have the capacity to do those kind of special measures, including patient rooms with a negative pressure airflow, specialized N95 respirators for all healthcare staff who might have any chance of contacting a COVID-19 patient, other kinds of personal protective equipment, administrative measures to make sure that there's no mixing of airflow and patients of different types. And I think the WHO decided in an early stage that it would be too difficult to recommend those airborne precautions. And so they kind of went from there into saying that COVID-19 is not airborne, which wasn't a scientific judgment. It was a practical judgment that it wouldn't make sense to go for the strictest level of precautions. Actually, in Hong Kong, we use the strictest level of precautions for COVID-19 patients. We use airborne precautions. And so I think now there's still this question about how it's spreading, which hasn't been resolved. But from the World Health Organization point of view, there'll be a reluctance to change the position completely because most parts of the world don't have the capacity to deal with airborne precautions for their staff if there are patients around with COVID-19 that just don't have the capacity to do that. And the World Health Organization has to provide the basis for recommendations for all those different countries in different parts of the world.
I asked this of Dr. Manamala from the Princess Margaret Hospital. What's keeping you awake at night, Dr. Cowling? What's your big concerns?
For me, it's fatigue, because I want to do the best for public health. I want to keep infections to a minimum, but I see already in Hong Kong people are tired of the public health measures. We're now 6 months in. I think it's unrealistic to expect a vaccine by the end of this year for Hong Kong. Maybe for some parts of the world, that's the earliest they could have it. And so these measures are going to be in place for quite some time. I would not be surprised if the whole of the next academic year for children is disrupted. That means from September until next July. And then there'll be periods of time when there's online learning and parents have to figure out how to look after their children at home. And it's going to be really, really tiring. It's almost like we have to write off the whole of 2020 as a year to forget, and maybe a large part of 2021 as well. And I think a lot of us feel really tired already, and we can't see the light at the end of the tunnel yet. I guess once some effective vaccines have been identified, that's when we'll see the light at the end of the tunnel, and then we'll just be waiting for enough stock to be made so that a place like Hong Kong can get hold of 1 million, 2 million, 3 million doses to start with, and then eventually 7 million plus so that we can vaccinate everybody. And then finally can get back to normal, can have our holidays again, and so on, because it's going to be a long battle against COVID-19, I think.
It is happening in Hong Kong. It is happening in Melbourne, in Tel Aviv, in cities across the USA. Right now, governments across the world are trying to figure out how to put their major cities back into lockdown. But there's more to it than simply saying Tong Sam Kong Yik, which is the Hong Kong government's slogan in Cantonese, meaning, together we fight the virus. People are resisting, rebelling against the idea of a second lockdown. You might think they are being silly or just plain selfish, but there is something deeper going on here. We've got a behavioral economist on the line from Beijing to talk to us about this.
Hi, I'm Jamie Lian. I'm assistant professor at CUHK Business School, Chinese University of Hong Kong. I do research in behavioral economics and microeconomics.
Professor Jamie Lian has worked in Chicago, at the University of Oxford, Tsinghua in Beijing, and here at the Chinese University of Hong Kong. But right now, She's stuck in Beijing because of the pandemic. She has written papers on all kinds of subjects related to economics, psychology, and behavior. But let's start with the basics first. Just what is behavioral economics?
So behavioral economics is a subfield of economics that tries to incorporate psychology, insights from psychology into economic models and look at their importance in economic situations. It studies a lot of kind of interesting sort of biases and other psychological insights that we can incorporate into important economic decisions like people's savings, investment decisions, and these kind of things. But it also applies sort of readily to our sort of everyday activities.
And that's why we got Professor Lian on the line. Because for all of us around the world, our everyday activities have been changed by the pandemic. And the biggest changes have been wearing masks and lockdowns, where businesses and schools are closed, and we're forced to stay mostly at home. And right now, behavioral economists like Professor Jamie Lian are looking at the problems with the second wave of lockdowns and talking about something called the endowment effect.
So the endowment effect says that when people have something in their possession, whether they originally had it or whether it was given to them and they consider that to be theirs, they're reluctant to let go of it. What it means is that the price that they would ask to sell that item is higher than what it would be if they would want to buy that item, that very same item. And so it kind of fits into this framework or is consistent with reference dependence, which is a framework that basically hypothesizes that people evaluate things in terms of changes. In other words, they're always going to tend to compare something to some benchmark. So in the case of, mask wearing and the second lockdown, it's going to depend on what people sort of have in their mind as that benchmark. If they think that things like eating out in restaurants and, all the things that we used to do in normal life are sort of our endowment or our benchmark, and they're comparing, what we have to deal with during the lockdown to that, then they're going to feel a sense of loss and they're going to be reluctant. And there are sort of other kind of psychological consequences and behaviors associated with that feeling of loss.
So people didn't really know how valuable their liberty and the freedom to move around was until it was taken away. But they were okay with it, thinking it was only going to happen once.
Well, that's right. And when governments were forced to announce a second lockdown, people got angry and rebelled against it. And we are seeing it across cities in the US, as well as cities like Melbourne in Australia, where a second lockdown has resulted in many more people being arrested and charged by police for breaking the lockdown rules.
So we asked Professor Lian if there is a better way of enforcing a lockdown than threatening people with punishment.
That's a very interesting question. So this gets into the idea of sort of how to, and there are studies in behavioral economics about whether punishment is better or reward is better. And, there are kind of a lot of studies that examine this, whether, a combination of punishment and reward. Definitely, I think for people, having a reward is sort of more psychological appealing than the possibility of a punishment, because the punishment will, again, sort of put us into a loss domain where, loss aversion says that we strongly dislike this feeling of loss compared to getting a gain. So, if there can be a kind of positive way to enforce and encourage, that's obviously appealing.
But there is a really interesting other side to how experts like Professor Lian are looking at this pandemic. On one hand, there's how governments are trying to change our behavior to manage the new surges and spikes in the community. On the other, it's how people are being asked to realize how their individual behavior will affect others.
One thing is that for the infectious disease, for something like COVID, there's a huge, what we call in economics, externality effect. So basically, our actions, even if we don't intend them to, are sort of going to permeate and affect other people in a huge way. And sort of through the transmission of the disease can be through sort of the second or third degree. I may not infect the people around me, but if I infect one person, then they may go on to infect others. So it is a situation with a huge externality effect there. And one thing is that ideally people sort of recognize that and sort of internalize that and consider that in their actions. And that would sort of relieve the need to be very heavy-handed in the enforcement, which also sometimes may not be very effective if it's always, and also from a practical and logistical concern, very difficult to enforce. So in an ideal world, people sort of realize the way that their actions could potentially affect others and sort of take that kind of into consideration and care about that internally and sort of regulate their own behavior through that channel. I mean, of course, it's an ideal world.
An ideal world?
I know we're far from an ideal world, but before that, we've had decades of capitalism telling us how being individual and buying the things we want for ourselves will make us happier.
And there's been a lot of discussion about how Asian societies, like what we have here in Hong Kong, have maybe a more developed sense of social responsibility. And that's why people didn't need to be reminded to wear a mask when the first cases were being reported. And we watched those videos of people in the US screaming about their human rights and not wanting to wear a mask and wonder, why are people behaving like this? Do they just not care about other people?
So one of the huge areas of behavioral economics that I also do some research in is about social preference. So how people sort of consider other people's outcomes in their own, how they consider that as part of their own sort of achievement and their own sort of happiness. Most studies have shown that people do care about other people to a great degree. Of course, the details of under which situations, they put themselves first versus put others first. It has always been sort of part of economics, the idea that we're not only just interested in ourselves, but interested in people around us, not only, people that we know, but also society as a whole. This has been something that's always been studied, but sometimes, when it comes to like a difficult decision about, yourself versus others, and there's other kinds of issues as well, such as the social distance, not in terms of like keeping a distance due to the pandemic, but how distant that person is from you in terms of how well you know them, can also play into how much weight people put on other people's outcomes. And I think that this is actually like the coronavirus provides some a good environment to study how something that's very consequential, how people kind of deal with this regard for others. And it is kind of difficult. And the other thing that I want to mention that I think that is very relevant in terms of behavioral economics concepts to the coronavirus epidemic is the idea of self-control. So oftentimes, especially when we are on lockdown or have to restrict ourselves from the activities that we enjoy, it involves self-control. And things like going outside and always wearing a mask, these things all involve self-control. If we sort of had our own, purely based on our own intrinsic desires, we wouldn't want to do those things. These kind of situations like what we're facing now puts people in a situation where they have to kind of continually exert self-control and sometimes exert self-control for the sake of others. So this sort of self-control factor and in what ways we care deeply about other people can kind of interact with each other conceptually and result in some of the things that we see.
So there was one more question that begs to be asked. After everything she's seeing around the world, with all the research she's done into the psychology of our choices and the things that influence our decisions, how is this pandemic going to change how we behave?
So some of my co-authors and I have discussed about this issue, and we're actually, when the coronavirus first happened and people had to be locked down, and just the huge drastic way that it changed our lifestyle and changed our beliefs and our kind of fears and concerns. The first thing as sort of experimental economists, because, as we oftentimes run experiments in labs and ask people to make decisions to understand basic features of their decisions, like their risk attitudes and their time preferences and things like that, we had this concern about whether or not the coronavirus as a huge event in the world was going to change some of those things. And it's possible, but I have to say that we don't know yet what the sort of direction of change is, as the whole thing is still going on. So we don't know what will happen, but I do tend to think that there may be some significant change, as this is kind of a very traumatic event for everybody.
So let's talk about the trauma of being infected with the coronavirus and developing COVID-19. Who do you talk to? Who keeps you company at night? And is there anywhere you can go online to talk to people without being involved in some sort of argument or angry conspiracy war about coronavirus?
My name is Jessica Stapleton, and I live in Carmel, Indiana, which is north of Indianapolis.
And what Jessica Stapleton does from her home in a little country town is moderate a Facebook group dedicated to people who have or who have had COVID-19.
So the Facebook group, it's COVID-19 Have It/Had It. It was really, for me, it was like a godsend. I did not start the page. It was started by somebody who did not have any symptoms. They just wanted to provide support. Otherwise, I'm not sure if it would have been started because everybody was sick. When I found the group, I had been sick for weeks already. And, everything that we heard at the time was, well, if you're in your 30s, you're going to be fine. It's just a flu. And you'll only be sick for a few days, maybe 2 weeks max. My own doctor even told me after 4 weeks that symptoms don't linger, only cough is persistent, which is not what I was experiencing, or my mother, who also has it. And we actually have gone through this together at the same time. But finding the group and seeing that there were other people like me, I mean, it changed my life. It really did, because I really thought that there was something wrong. But I was able to see not only were there other people like me, but there were lots of other people like me. I became active in the group because I was bedridden for over a month, maybe 6 weeks, completely quarantined from my family. We did not know if I was contagious or not, which was very hard. So I had a lot of time where I did not want to focus on the fact that I could not get my air in. So I spent it on the group and talking to other people. And I actually spoke with the admin, and he asked me if I wanted to moderate. I moderate and I try to support other people, but I honestly couldn't have done it without them.
And this is what she told us about what kind of things people are posting. And before you ask, yes, there are strict rules about giving out medical advice.
Well, we see all kinds. We do try to keep it support-based, which, as you know, trying to keep a group focused can be a little bit tricky. When I first found it, I read testimonials where this person started symptoms the same day I did, and they had these symptoms. And, back when I first got sick, I only had Tom Hanks. He was the only one in the media. And then he and his wife got better, and I was still sick. So to be able to see and compare and to know was it was life-changing. But you do see a lot of questions, just single line questions, maybe the same ones a lot, but hey, does anybody else have this going on? My chest feels very heavy, like somebody's sitting on it. And then other people can tell them what their doctors might have mentioned to them or something that could help. We try not to give any medical advice, but it is nice to know that, other people are feeling it, and hey, you do need to call your doctor.
So how does moderation of a Facebook group work during a pandemic? How do they keep things civil and respectful, and most importantly, factual?
Actually, it's pretty minimal. We do try to keep it focused on care and support. It does bleed through, and I was talking with other moderators today. We have to stay impartial, and we can't be political, even if we have political views. Even if we agree with somebody, if their comments are out of line, we have to moderate that, which is difficult. There is a crisis going on, and we're not ignoring it by any means, even though some people in the country are. But we do try to keep it based on symptoms and mental health, and just trying to keep it focused.
So what does she think about how the scientific and medical advice has changed? Everyone from Donald Trump telling people to inject bleach to the changing advice about masks from both governments and medical authorities.
It's been maddening. I was quarantined before it was okay to wear masks. We were told that only healthcare professionals know how to wear them, which when I heard that on the radio on the way to work one day, I thought, if we don't know how to wear them, how about a YouTube tutorial? I mean, YouTube is great. But even I could see it was just them trying to get us to not buy them so medical professionals could get it. You know, and then I did fall sick and I was actually out of my mind. I lost probably 2 or 3 weeks. I have no idea anything that went on in the outside world really in that time frame. But I do remember early on telling a friend that, you know, even if a mask helped 1%, wouldn't we want to help this huge issue 1%? And it actually, I feel like it did change her mind. And she thought, you know what, that you're right, we should do what we can. But, you know, I log on to Facebook and there are these just warriors out there about not wanting to wear something that there are studies saying that it could help, and it does help. And I just don't understand why some people wouldn't want to help for the greater good.
And what's it like to be a voluntary moderator on a Facebook group concerning an issue that's brought all kinds of craziness and conspiracy theories out into the open? Even worse, what is it like to try and do this in Trump's America, where people were already bitterly divided?
So we do have some alert words that we all get flagged when they come up. I mean, we've had anti-vaxxers. We have to flag the word hoax, the word cure, 5G, just so we can go and see what's going on immediately when that happens. I think people would be surprised how much moderating goes on behind the scenes. You know, there are people that do have their beliefs, and we have to look at it as, okay, are you spreading misinformation? Is somebody going to correct you? Are you going to take it well? So we do see a little bit of that. I will say it is kind of a safe space from conspiracy theories because the people there generally are sick and they've had it and they get it. When I venture out of the group and start just reading on my normal feed, that's when I see most of the misinformation about, masks cause you to breathe in your own CO2 and just incorrect information. And people are just determined that it's right. I try to be good and not get in Facebook fights, but I definitely have unfriended some people over it, that's for sure.
Beyond having to be the security guard trying to keep discussion polite and constructive, we wanted to know how people are helping to contribute to the mental health struggle that everyone is dealing with in some way right now.
Well, we're going to see all flavors of support. Some people will just, do the hug emoji, which is new. Some people will write a novel. And some people will say, hope you feel better. I feel like there are quite a few people that like to just write down their thoughts like it's a journal and let it out there. So we definitely have all different layers of the mental health aspect for sure. There are, on that note, there were more so earlier on where doctors were blaming our longer symptoms on anxiety or just like a mental health thing. So I have noticed lately that people are starting to realize that the effects can take longer, but there are like thousands of people that were told that they weren't still feeling symptoms, that they were just anxious. And my doctor actually did ask me if I had anxiety at one point. So I totally get it.
Wow, did a doctor really tell a COVID-19 sufferer their breathing problems were all about anxiety?
I know, but this group isn't just appealing to American people either. This is what she said when we asked her where the group's members are from.
We have more than 11,000 members. Most of the people are from New York. And then after that, it is broken down by cities in the U.S. But after that, after New York, it's actually the U.K. And then it kind of goes down from there. But a huge amount of people in New York, huge amount of people in the UK, spread out the US. I mean, we have South Africa, Sweden, everywhere. You name it, there's somebody.
And while we asked Dr. Manimala as well as Professor Cowling what keeps them up at night, we asked Jessica the opposite question. How does she keep her hopes up? And how does she stay positive in all of this?
Well, right now I'm to the point where I am just trying to keep busy. There was a point where, when I was very sick and I was very scared and I didn't know what my future held. There was a tree outside my window that was beginning to bloom for spring, and I would stare at that. So that brought me hope in the beginning, and also being able to FaceTime my children from the next room and knowing that I needed to be there and be strong for them. I'm sorry. I didn't mean to get emotional, but I do have hope. I try not to read the news because I call it not the news cycle, but the doom cycle. Right now, it's not looking like a great news cycle. So I'm at the point now where I think I'm just trying to keep busy.
And having worked with this group of people she's never met, who just like her, don't get paid to do this very intensive job, does she have any plans to meet them?
I'm working with them every day. Some days more than others, that's for sure. I've never met a single one of them, but we have joked about one day meeting up somewhere in a foreign country, have coffee. They're definitely some of my best friends right now.
Well, just for the record, and just because we're optimists, we invited Jessica and the other moderators to come here to Hong Kong for milk tea and dim sum one day.
That's all we have for you this week. Thank you for listening, and thank you for sharing us and rating us on iTunes and all the other platforms out there. Don't forget to stay up to date with everything that is happening on SCMP.com. My name is Mimi Lau.
And I'm Kinling Lo. Wash your hands, keep your distance, but know that you're not alone.
And stay safe.
For more podcasts from the South China Morning Post, head to scmp.com, where you can hear more about technology, trade, culture, and society.